Thank you for taking a few minutes to watch and listen to this video on family medicine in South Africa. The purpose of this video is to try and clearly explain what is the role of the family physician in the South African health system and what contribution they make to that healthcare system. In this video, we explain the role of the family physician in terms of 6 roles. The roles are, first of all, that of a clinician and a consultant to their healthcare team, a capacity builder to that same team, and sometimes a clinical trainer to undergraduate or postgraduate students. The family physician is also a supporter and a champion of community-orientated primary care, and often takes the lead in terms of clinical governance within their facility or sub-district to improve the quality of care for the people that live in that community.
What is the role of a family physician in terms of community-oriented primary care? This, to my mind, is a very important role where you not only be a clinician where you look after your patients, but you in fact think beyond about the community and in fact the population, those patients that belong to your practice and sometimes, most times, are actually not your patients. How do you go about that exercise of being community oriented? It's essentially to be able to understand and profile that community out there in the neighborhood that you live in or that belong to a panel, understanding precisely who belongs to you and what is their health profile, but also what is their risk profile, precisely what makes them at risk for ill health. And this can include social determinants of health, not just simple behavior challenges like smoking and obesity, etc.
And I work in a semi-rural area in Malmesbury, and the question is, what do we really do in private practice, and how are we different from general practitioners out there? First of all, I think the whole point in terms of family medicine is the idea that it's a biopsychosocial model, and it's actually come to fruition when I was in private practice. Clearly because I think there's a bit more time. And what really added value is the time we can spend in the consultative process. Really trying out and doing those things that we were taught in the training. The impact it has is enormous. People are happy, they understand, you get to the bottom of where the problems really is. It's also a bit frustrating because you realize it's not only a biological problem.
Clinical physician in this area, I had to work in my clinical role as a senior clinician, basically to ensure that basic medical, surgical patients are treated optimally in the facility, also to perform common medical procedures at the facility. These included procedures such as performing cesarean sections, doing evacuation, doing explorative laparotomies, performing anesthesia, performing life support to both the neonate up until the elderly. My role as consultant in the rural setting, you're often the only senior clinician in the facility, which means you have to basically be an all-rounded doctor who's always available. So in this capacity, I had to ensure ward runs are done on a daily basis, have to ensure patient plans are done effectively, and to ensure that patient safety and care is provided. To provide supervision to junior staff, community service doctors who've just completed their internship, who still requires a lot of supervision. We perform after-hour duties in the facility. These include being the doctor on call for the emergency center unit, being the doctor available to perform emergency operations at night, as well as the doctor performing anesthesia in the department.
How do family physicians capacitate the primary healthcare team? I think the one thing to recognize is the value of each individual team and the team members. And for me, the team consists of community health workers, the ward-based outreach teams, and then extending to the facility. And at the facility, it's not just the nurses and perhaps visiting doctors. It starts really with the gatekeepers, the security, the ladies who clean. And I think it's important to get the whole team on board. And sometimes guidelines are quite prescriptive, and nurses feel very intimidated by managing difficult cases. And so to be on the end of a phone to say, that's good, yes, I agree with you, follow that, do that, I think that can also build a team up. So I think for me, relationships and getting out there, actually being on site, visiting people and being overall encouraging is probably what's the most important thing for me.
As a family physician, I am involved in training of undergraduate students, undergraduate clinical associates, undergraduate medical students, and also registrars. Registrar training is also, as people may well know, very, very important in the sense that you want to have an unending production, if I can put it that way, of family physicians who are going to carry on with the teaching of family medicine, who are going to add to the body of knowledge of family medicine. So the registrars are also taught in different areas. They are taught from the primary healthcare settings up until the regional hospital level.
When it comes to the role of improving the primary health care or the primary care system, what's been most thrilling for me has been getting involved with clinical governance, and more specifically the quality improvement cycle. When we looked at how we prescribe antibiotics, it was really exciting to be able to see clinicians being able to step back, using guidelines, taking a look at their folders, and engage in the quality of the work that they were doing in a meaningful way, to the extent that it then began to translate into how they worked. You then began seeing clinicians interrogating each other and interrogating their folders, even out of the space of the clinical government and the quality improvement meetings in the practice that they were doing.
One of the areas of quality is safety, and to evaluate safety in the surgical environment in district hospitals, I looked at what effect a surgical safety checklist would have on 9 hospitals in KZN. We found that it was significant improvement in post-operative complications and an improvement in mortality. I did a Delphi study with a whole lot of stakeholders, and the new cesarean section safety checklist is being now introduced in the National Maternity Case Record for use throughout the country in all hospitals offering cesarean deliveries.
One of the ways of advancing a discipline is through research. Our national research project showed that family physicians are making an impact in terms of health system strengthening, and this was testified by district managers as well as their colleagues. Family physicians exert their influence through their teams in which they work, and they bring a set of comprehensive skills closer to the community where it's needed. They also help to coordinate care between different levels of care and ensuring better continuity.
The specialist in family medicine undergoes 4 years of postgraduate training to become a family physician. And our medium-term goal is that every district hospital, community health centre and sub-district in South Africa should have at least one family physician.